Hi, I'm Dan Eman, the emergency manager for the city, and I'll be doing a short presentation on H1N1 influenza, what we're doing to plan and respond to a possible pandemic. So basically I'll be going over today what H1N1 really is, what's different about H1N1 as opposed to the seasonal flu, what's currently happening, what could happen, what the city is doing to prepare, and what's left to be done. So first off, what actually is H1N1? It's basically a virus. This is how you get H1N1. It's actually not the case. It was called the swine flu basically because it has some of the same properties as a flu that pigs got, but there's no transmission from human to pig and vice versa. You hear a lot in the news these days, it's H1N1 novel influenza, and essentially all that means is it's new. We haven't really seen it before. It first popped up in the US and Mexico around March and April. You'll kind of remember the first round of it. It's been going ever since, but now that we're heading into flu season, we've really started to think about how this thing could expand on us a little bit. It spreads the same way as any other flu. It's mostly through coughing and sneezing of people that are infected, the droplets basically that come in contact with you either through direct contact or through coming in contact with something that they've had contact with. Basically, they sneeze on a doorknob, you come 3 or 4 hours later, put your hand on the doorknob, open the door, and then you rub your eyes, rub your nose, that kind of thing. That's really how any kind of flu is spread, and H1N1 is no different. One of the important things to remember is it takes a good 6, 7, 8 hours for that droplet essentially to become non-contagious. So that's one of the reasons that cleaning and washing your hands is so important. It presents much like any other flu. You almost always have a fever, typically high, cough, sore throat, achy, pretty much the same thing we've all had when we've had the flu before. Through the H1N1 virus, it's shown to be very contagious. The transmission rate is actually pretty high. People are considered to be contagious a day before the symptoms appear and up to 7 to 10 days after the symptoms resolve. Pretty similar, except this one seems to be a little more contagious than the normal seasonal flu. Again, it's a novel virus. That just means it's new. It hasn't been in the human population previously to the detection, and importantly, nobody has immunity to this kind of virus. We haven't seen it before, so we haven't been able to build up the immunity like some people had to the seasonal flu. A really important point to remember when we're talking about this H1N1 is every year 36 to 40,000 people die of the normal flu. Happens every year in the United States alone. We typically don't see that in the news because it happens every year. It's not anything new. We see 210,000 people hospitalized every year from the seasonal flu. But normally we see those hospitalizations and deaths in the 65 and older bracket. 90% and above, that's where people normally die, is the older population. The H1N1 is different. What we're seeing in H1N1 is the hospitalizations and the death rate is actually in the young, healthy population. People 25 years and younger are the people that are getting sick violently and actually dying of this disease. So currently, from April to August this year, we've had over 9,000 hospitalizations directly related to just H1N1 and 593 deaths. Now those numbers are a little bit skewed because really all that tells us is those are the people that have been tested positive for it. So a lot of the times what's happening is people are going into the doctor's office, they've got the flu, it doesn't really matter which kind they have, they're getting treated and sent home. They're only testing people that have been hospitalized. So these numbers don't represent really how many people have actually had it. But what it does give us is a way to track who's dying from it. Locally, we've got 85 probable cases at CU. Those tests are still coming back. So we haven't seen a lot of cases in people 64 and up of the H1N1, which is really unusual. That's one of the troubling things about H1N1 is who it's affecting. 50% of the people that are dying are 25 years old or less, typically young, healthy people. And something else that's different about H1N1 is it's responding to Tamiflu, which is a kind of a antiviral medication that really has been phased out of the seasonal flu because it isn't all that effective. So that's good news for the H1N1, but you have to really catch it within 1 or 2 days or it isn't that effective. One of the age groups, the groups of the population that's most affected by H1N1 seems to be pregnant women. And that's pretty disturbing, so we're really keeping an eye on how that presents in pregnant women as it affects the mothers and the babies. Some of the things that make this thing worse is asthma, diabetes, suppressed immune systems, all the things that make a high-risk population, that's who this is affecting the most. So here's the fear. The fear is people don't have immunity to the virus, people are going to get sick, and we're going to transmit this disease in populations that typically don't get affected by the seasonal flu. So we have the young and the old affected by seasonal flu, and unfortunately the middle of the population that are infected by the H1N1. So it's kind of giving us a little bit of a worst of both cases that it's presenting out to be. The good news is the mortality rate from H1N1 isn't that high. So it is affecting the young, healthy population, and those are the people that are dying, but as a percentage of the whole, the rate is way less than the seasonal flu. So that's the good news. The flu is a deadly disease. We have to remember that. 30 to 40,000 people die every year from the normal flu, and that's not counting the H1N1 population. So what could happen? The thing we're most afraid of is employee absenteeism from a city perspective. So really what we're talking about now is what's going to affect us as a city. So we could see up to half our workforce out, and that doesn't mean that they're sick. What that means is they're not at work. So because the H1N1 is affecting school-age children and younger, we could see schools closing, daycares closing, which will cause our population to have to stay home and care for their children, whether they're sick or not. So we're trying to keep in mind that we could be out 20, 30, 40% of our workforce every week. We could see our local hospitals and clinics becoming overwhelmed with either people who think they have the flu or people that do actually have the flu. And we have to remember their workforce is affected too. So that's something we're really trying to keep an eye on, is how are our healthcare providers able to treat the people that we're responsible for. One of the other things we're thinking about is if we're not affected, other people close by are. So if we have neighboring counties that could be affected, they could be asking us for help. So what are we prepared to provide as far as, do we need to provide fire department, police department, other kinds of assistance to areas of the state that are really highly affected. Another possibility is not much is going to happen. We could have a normal seasonal flu like we do every year, and nothing much is going to happen from H1N1. So what are we currently doing as the city to prepare for this? CDC and state and local health agencies are monitoring this thing, as you can imagine, every day. We're trying to take our lead from them. So we've created a pandemic team consisting of Deb Carson and Doug Spite from RISC, Hank McCarthy, the EMS coordinator for the fire department, and myself. So we recently met, and one of the things we're doing is reviewing the pandemic annex to the city's emergency operations plan. This is something we had in place from when the EOP was officially adopted earlier in the year, and we reviewed it during the March and April timeframe, and we're kind of breaking it out again to make sure that it has everything in there that we need to have in case it does get really bad. We've also met with the directors, made some recommendations to them, and one of those is encouraging managers to send their employees home that are sick. So remember, the way this thing gets spread is through human-to-human contact. I sneeze, somebody else is near me, they get sick. So we're really trying to make sure managers are looking for their employees that are sick and sending them home. And they should stay home until 24 hours after all their symptoms subside. So that could be 5, 6, 7, 8 days. We're helping departments with continuity of operations planning, or COOP planning. And really what that is on a departmental level, identifying what services are critical to keeping the city going and how are you going to provide those services if you have a third of your workforce out. The Emergency Planning Committee is a group of all the different departments that have been meeting monthly for a couple years, and we're talking about this at that meeting too. What they've been tasked with is to go back to their departments and talk about what are you going to do if you have that workforce absenteeism happening. If you have 40% of your workforce out, how are you going to deal with that? We're going to have a tabletop exercise in October that's dealing only with the pandemic flu. So we're going to be doing a 2 to 3 hour exercise on how do we get help from the state, what's really going to happen, do we need to do some emergency declarations, that kind of thing. How are we dealing with resources coming in and going out, reduced workforce, and really something that we almost never deal with is the recovery aspect of this. What are the lasting implications if we do have a pandemic? If we do have something really unfortunate like 10% of our workforce that actually dies, how do we deal with that? What do we need to do to recover from a pandemic? And again, reviewing our departmental COOP plans. OEM, some of the things that we're doing is meeting with the Boulder County OEM, the large fire departments in the area, and Boulder County Public Health every 2 weeks, just as an information sharing. We're talking about what's going on, what are you seeing from a public health perspective, and what do we need to do to help you. Communicating with the school district, the large employers in the area. We're trying to make sure everybody's talking to each other. Are we starting to have an outbreak at a local school? Is one of the large employers seeing a lot of their people being sick? Trying to get ahead of it as much as we can. Working with the city PIO and other public safety departments, we're trying to make sure that the public and our city employees are informed. I think that's probably the most important thing that we're going to do right now. Keeping our website updated, trying to get things in the newspapers. We've reserved the fridge cards in the utility billing. We're trying to get messages out any way we can. We had something in Longmont Life. We're going to try to keep doing that as much as we possibly can. Just educate the public. Now, part of that message really needs to be the same 4 things all over and over again. First one, wash your hands often. And I think there's a misconception as to what washing your hands really means. When you're washing your hands, you really should be there for 15 to 20 seconds. If you don't have soap and water available, you can use those alcohol-based gels. Make sure you rub them in completely until they're dry. Stay home if you're sick. And that's probably the single most important thing we can communicate to people is if you're sick, don't come to work. All that's doing is making everybody else more vulnerable. Cover your mouth if you're going to sneeze, and go get your flu shot. So what's left to be done? Monitor what's going on. Currently, we don't see anything happening with an H1N1 specific vaccine until October 15th or later. And what we're currently being told is the supply of that vaccine is going to be very, very limited. So what we're told now is you could have 2 H1N1 shots separated by 3 weeks and 1 seasonal flu shot. So as that H1N1 shot becomes available to the general population, you could be asked to go get it twice. Since the supply is going to be limited at first, the CDC has determined there's 4 target groups that are going to get the first crack at this. The first one is pregnant women. And we talked about why that is before. They're really one of the most vulnerable populations. And then people aged 6 months to 24 years, because those are the people that are really affected by this. And then the rest of the population up to 64 with underlying health concerns like we talked about before. Those people are going to get the vaccine from their healthcare providers, and there's going to be a very limited amount available, and the healthcare providers are going to be really asked to monitor who gets that. They're really asking them, don't just give them to your friends, don't give them to everybody that comes in. Really make sure that the people who need it most are getting it first off the bat. The 4th group is the hospitals and the EMS workers. Those aren't going to be given through the healthcare providers. Those are going to be up to the local jurisdictions to give them to our fire department, our AMR workers, our ambulance workers, and trying to reach out to the smaller agencies around us to help them get the vaccine too. So they're going to give some to the hospitals, and they're going to give some to the counties. And it's going to be up to the OEMs of the county to kind of figure out how we're going to get those to all the fire departments and EMS workers in the counties. What's left to be done? Continue to take the lead from Boulder County Public Health. They're the lead agency in this. We're going to basically do what they tell us to do. They're the experts. They really understand this more than we do. It's our job to be prepared for what they ask us to do, but don't get out there and lead the way. They know what they're doing. We're going to continue to follow that lead. Monitor as much as we can. If things do get worse, we do have that pandemic flu appendix already in place that we can draw on, and we're going to continue to kind of train and exercise what may occur. monitor the status of the vaccine. The intent of the government is to give this out to everybody, is to make it available to anybody that wants it. But one of the things we may be asked to do is communicate to the people what does this really mean? Why should you go get this vaccine? And making sure the people that need it but may not have access to it right away are able to get it. The special needs population, the Spanish-speaking population of Longmont, how are we going to reach out to those sections of the populace and make sure they get this vaccine should they desire it? Where can you get some more information? The two websites that we're really monitoring closely are the CDC and Boulder County Public Health. So those are really what we're trying to point everybody to instead of all the other news outlets around. This is the source of the information. So we're trying to allow people to make determinations on their own rather than point them to the interpretations other people have made. So one of the important takeaways of this presentation, if you look like this, don't go to work. That concludes my presentation, and I will be there Tuesday night to answer any questions that you may have.